This is called the Intra document. On the left hand side, you see the menu. These are all called segments. Each and one of them have their own document. Notice the exclamation marks? That means that they have required fields in them that must get completed. We're going to start off with the Who sign-in. You would then press Next to get onto the next page. As you can see here at the bottom, this segment, Who Sign In, has 2 pages. Depending on your screen size, if you have a smaller screen size, you will have more pages. When you're searching for someone that has a common name, you would say multiple matches found. You will then select the magnifying glass to get a wider search. And you can see here we have 3 people, similar names. Once you have found it, you'll select it and then press OK. Once you have completed it, you can then press Next to get onto the next segment, which is the case times. And in the case times, you'll notice that the time patient sent for and the time patient arrived would have automatically pulled through from the perioperative tracking board. When we selected the status box, that would have pulled through over here. Now I'm going to add the time in an anesthetic room. You'll be doing this in real time, so once you select it, the time for now would then appear. I'm not going to add the time anesthetic stopped and the time patient left theatre and the procedure stop time. I will come back to it once I've completed the document. Or you would go back to it once the theatre procedure has stopped. As you can see that this was 2 pages. So this is the final part, the theatre outcome, and I'll come back to that once the operation is done. You'll notice for the Who sign-in segment, it's got a green tick because we fully completed it. Case times will not have a green tick because we have not completed it fully. Once we have, it will then come, the green tick would appear. Case staff. You'll search for the case staff member that's involved in the procedure. And then you'll select the role performed by that staff member. Once you have done that, you will then press Add. But before pressing Add, I would like you to notice that there is already a staff member in that box at the top. And that is the consultant surgeon, the consultant that is in charge of the procedure and the consultant that is in charge of the patient. You'll also find the consultant's name at the top, the blue banner. Now to add this staff member, you will then press Add at the bottom, and their name would appear here. And everything should go blank, allowing you to add another staff member. We'll select the magnifying glass, select the one staff member that I am talking about, and then I'll press OK. I'll select the role performed by that staff member. I'll say he's an anesthetic practitioner, then I'll press Add. Notice that this is just 1 page, so now that I've completed this, once I press Next, it will take me to the next segment, which is the Who timeout. In case staff, you'll notice it has a green tick. If I want to go back, I'll just select the case staff. Sometimes you'll get up to 10 staff members, maybe even more. And it's a little bit difficult to identify any errors that have been made here. To get a better view of this, you can click onto these 3 dots on the far right, this ellipsis, and you'll get a long list of all the staff members that are involved in the procedure. In Who timeout, you'll notice that it has 3 pages. Notice once you click onto this, that list of staff members that you've added into the segment K staff would appear here in this drop down list. I'll then press next to get onto the next segment. The segment that we are currently in now is the general case data. Everything does seem like it's filled in apart from the ASA class. I will select 1. Of course, you will know what class they're in. 1 meaning they are very fit. Notice how that this is 2 pages. So before adding the procedure on, you'll have to identify if there is a procedure already added into the box above, and there is. Now I'm going to select that procedure so I can see the answers or anything that may have been missed out on. Once you select it, the answers would appear. Notice that the additional procedure details might not have an answer, or the surgical site may not have an answer. However, if there wasn't any additional procedure details, you can leave it blank, and surgical site as well. I'd have to press next to see the next part of the segment. I've noticed that the consultant surgeon present has not been answered, so I would answer it. And the operating surgeon has not been answered, so I would answer it too. I'm going to leave this one blank, the procedure stop time, because I don't know the answer for it just yet. Once I've now modified my answers, to update it inside this box here, I will then select modify. Now everything should have gone blank, allowing me to add a new procedure if there was another procedure added. So procedures does not have a green tick. The reason why is because we have missed out some mandatory fields. Patient positioning and warming. I've noticed that in the box above it has no answers. I've also noticed that it has 2 pages. So before I press add on this page, I would have to answer both pages and then press add to add it into the box. Once I've answered this, I'll select the arrow to move it into the box. Now positioned by, sometimes it may be more than one staff member. So remember, I'll press the arrow to add it into the box, allowing me to add another answer. So now I am not going to press add just yet because I need to go onto the second page to answer the final parts of this question. Now I'll press add, which would add all my answers into this box above. Once I've pressed next, patient positioning would have a green tick. Now I'm on skin prep. Once I've completed it, I'll then press next to get onto the next segment, which is the skin assessment. In the skin assessment, I've noticed that in the box above it has no answers, which will require me to add it in there. I've also noticed that it has 2 pages. So I would press add on the final page. Once I'm done, I'll then press add to add it into the box above. Diathermy. Once you've completed the document, you will then press add to add the answers into the box above. Bear in mind, you have to always check how many pages it is before pressing add. Once completed, you'll then press next. Pre-op count. Always bear in mind that there are 2 pages. Pre-op count's completed and it's showing me it's got a green tick. First count, I would say count's corrected, yes. Once completed, I'll then press next. On to the final count. First count has now got a green tick, which means it's completed.